Hey everybody, I wanted to start this video with a reminder to everybody and to myself that the reason why I have been calling these videos Amazing Life with HD is because I have really had an amazing life. At 42 years old, I've done more things than, people that live to be 100 have done or even thought of doing. I've seen many oceans, sunrises, sunsets. I've seen storms, beautiful storms. I've seen floods. I've seen rivers and creeks all over the place. I've seen beautiful, beautiful sunny days. So many sunny days. I love the sun. I am a sun worshiper. Love the sun. I have some wrinkles to show for it, and that is just fine with me. But yeah, I don't want to always focus on the negative of what the disease is and how, how it affects everybody. I want everybody to remember that even though you have this disease, there are so many amazing things that you can do. You don't have to let anything hold you back. But I did want to get on here and talk for a minute about something that is, not the greatest thing. If people have known me for years, they know that over the last couple of years, especially year to 2 years, I have really been struggling with my self-care, especially my biggest area of issue is my dental health, my mouth. I've been struggling with that seriously, tremendously bad for at least a year. Brushing, flossing, the works. It just is all hard for me to get done. That is part of the apathy issue that I have with HD. It kind of causes me to not stay on top of things, with my appearance, my face wash, staying on top of my acne, things like that. Not always caring what my hair looks like, which I've kind of always been that way, but I've always cared about my mouth. I've always had great dental hygiene. I was just raised that way. My granddaddy had great teeth, and I was very lucky, and I had great teeth too. I got into my 30s or later before I even had a cavity. I didn't know what that experience was like. I just naturally have, good quality teeth and genes when it comes to that area. Some people struggle with that area, whether it's, HD or not, but the thing is, I had like a realization yesterday when I went to the dentist because I was having some swelling and tons of hurting, and so they actually had to pull a tooth. So I lost my first tooth to poor dental hygiene, and I'm still healing, and it feels really weird. And I also have gum disease going on, so I'm having to treat that and go back and have some deep cleanings done to get tartar buildup off of my gum lines on my teeth. Just a lot of work that has to be done. The only good thing coming out of it is that my husband told me yesterday that at least the tooth I lost was the top back one and not one of my front teeth, because that would have made me very, self-conscious about talking to people. So it was kind of a wake-up call for me that, I need to make sure that I'm not losing any more teeth. And I have to go into the dentist to get these deep cleanings done, to help get taken care of the tartar buildup in my gum lines, and the antibiotics and, the treatment and all that they're going to do with me to help get my teeth back on track, which they said I can do without losing any more right now. So as long as I try and stay on top of it, I should be doing okay. I used to have this pearly smile that I just love smiling all the time. I just like to smile. But I didn't mind that people saw my teeth because they were just all these beautiful white teeth. And every once in a while I get picked on because I was told that, like, especially my front two teeth were just so white that they look like these big white chiclets, from the gum that you used to chew. I don't know. That's different people's time or whatever, but I had those when I was a kid anyway. And that made me feel bad. Like, I'd be like, seriously? But no, I loved my smile, and I just didn't realize what other people went through, even not having anything to do with HD, what they go through, the struggle with dental hygiene because they have bad genes, or serious smokers or coffee drinkers, or that kind of stuff. It's just it's a struggle. Some people have really bad breath issues, and it's just like something that's been passed down, a bad gene of just really bad breath, and it just comes from deep inside, and it's like it's not something you can like fix with dental hygiene and whatnot. So I just learning all these things and seeing my struggle, and being embarrassed to smile when I go out, which is something I never used to do, and because I just like to smile, it's just who I am, I feel like. But I would like kind of cover my mouth more, or be like, oh no, I didn't brush my teeth, I better not smile at anybody, and try not to get close to them, and whatnot. And so this has been a huge wake-up call for me. My amazing life has once again been amazing because I've lost a tooth, but like I said, my husband reminded me it was back here, and it's not one that is affecting me chewing, which is the biggest issue, but the self-esteem part, because it's not one in the front, and I've just got lucky again, because not everybody has that. A lot of people lose their front teeth, and it's very uncomfortable for them to have to do that, smile and talk. So anyway, just said all that to say, yeah, I still am living my amazing life with HD, but I am currently in a little rehab here, letting this heal up, and it is not fun, and the gum disease is not fun. And so yeah, like I'm here, and I get it, is all I'm saying, and I know what it feels like to battle with those things, and you're not the only one. And just try to do your best. Like, I know reminders don't work. I know, I've tried so many things, and it's like it don't work. But this seemed to have gotten my butt in gear. Like, just going in there and having them, take out a full freaking tooth because there was no way to save it. Yeah. And luckily, like I said, it's over here, so I just got lucky. My amazing life again is amazing because I have a chance. They told me to still save my teeth, and the gums and stuff, just got to do all that stuff. So hopefully, maybe this can be your wake-up call instead of you waiting until yours gets out of control. To just, get in there and do what needs to be done. I mean, that's hard. Like, people don't understand how hard it is. You can just go in there and do it every day. And I used to could. That was just like part of my routine. But, there was no, but it's like, those chemicals in there, it's hard to, they just do what they want. And, so it is what it is. But thank you for listening. My New video is not that fantastic, but you know, just a little update on what I'm doing and going through. Have any comments, questions, just let me know, and I will see you next time. Thank you.